So the fact that you were able to do that in Tanzania and create an unprecedented path of disruption to the status quo is absolutely astounding.
Taking care of mothers, especially pregnant mothers, is like you're taking care of a future. We have a female president, so she's a mother.
Yeah.
And being a mother itself makes you grounded to understand what are others going through. Context of Tanzania really is heated by the culture. And culture has different dynamics depending on where you are, which region, and how do they perceive women. We want insurance for these babies because we're paying from our pockets. And it's getting really bad. Some of us are selling our houses.
Wow.
So like one of the mother was trying to sell me her phone so that she can pay the medical bill.
Culturally, same thing. It's an expectation.
Sure.
And so moms can't push up against that expectation without feeling like, are they doing something wrong?
If you know that I'm passionate about this work, you have to believe in me and invest in me.
Let's do it together. We're in this together.
Yep. Woo!
Hi, everyone, and welcome to the Born Into podcast. I'm Isra, Chaker, CEO of Every Pregnancy and the host of this incredible show. This podcast is about something that impacts every one of us, but is rarely talked about enough, the health of moms. Each week, we bring you stories of courage, resilience, and facts from around the world about what it is like to be a mom, support a mom, or help a mom. And today, I am so excited to be here and joining you from a studio in New York City, where we are here at the beginning of the United Nations General Assembly, kicking off in New York to bring and disrupt the way that maternal health is discussed and is supported. All the way from Tanzania is Doris Mollel, an extraordinary champion whose activism began with her own story. She was born preterm. Some quick context for this episode. According to the World Health Organization, in 2020 alone, over 13 million babies were born prematurely, meaning they were born before 37 completed weeks of gestation. That is more than 1 in 10 babies worldwide. Preterm birth is the leading cause of death among children under 5, responsible for nearly 1 million deaths annually. The reality is that most of these deaths are preventable. Tanzania has one of the highest preterm birth rates in the world, where preterm births account for up to 40% of under 5 deaths. This problem disproportionately affects low-income families. So why is this happening, and what can be done? Doris has been leading the charge in Tanzania through her foundation, the Doris Mollel Foundation, creating solutions that save lives and strengthen systems. She has received numerous awards, including the Tanzanian Humanitarian of the Year, recognition in Tanzania's Leadership Hall of Fame, and she serves on numerous boards, including Save the Children Tanzania and Hope for Young Girls Tanzania. She is also a proud Ashoka Fellow. And I am honored to announce that the Doris Mollel Foundation is part of the Every Pregnancy Coalition, being an incredible partner for us on the ground in Tanzania. Doris, welcome, and thank you so much for being on Born Into today.
Thank you very much, Isra. I feel proud to be here because every pregnancy means everything to every mom everywhere in the world.
I love that. And thank you for starting off with such a beautiful mantra for us to get this conversation going and carry what I know is going to be very impactful for hearing more about your story. And maybe before we even get into the work that you do at Doris Mollel Foundation, I would love to know, who is a little bit of Doris? What would you want to tell our listeners about you?
So Doris Mollel, actually, she is prematurely born girl, a firstborn twin. She's a mother, she's a wife, but she's a proud daughter who has decided to take her story to save her country. And the only story got attached to my attention when I was 23 years of old, and I just finished the Beauty Queen of Tanzania. I'm a former second runner-up of Miss Tanzania, and usually when you're a Beauty Queen, you're normally tasked to do something for your community. So connecting with what my mom used to love, to give back to community. So usually my mom would be that person who say, can you give certain kgs of cassava, maize, or sugar when someone comes to visit home and she's in need? So when I told her that I want to do support my community, what's your idea, mom? And she was like, what do you want to do? I told her I want to do disability. She said, don't do disability because you're born too soon. But I told her, Mom, what is to be born too soon? So she started telling me that. So my mother gave me a story of my life, the challenges of me being born too soon, not be able to drink her milk, suck her milk.
Wow.
So I was taking milk through a feeding tube. I was in an incubator for 3 months.
Gosh.
But again, I was facing challenges of breathing. So I was on machine for a single month. So all those trauma, all those stress that she was facing are the stories that she gave me. But then I didn't understand. So she told me, please go and see for yourself. So she connected me with a medical doctor who was in charge of the premature unit at our national hospital in Mwimbili, Dar es Salaam. So I went there. The first thing I get in so excitedly, I didn't know what I would find. So by then when I started talking to the doctor, he said, oh, you want to do premature babies? The first thing you need to look into awareness and equipment, because that's the first thing you need to work on. It's like, okay. But then a nurse intervened. And she said, we need to take care of a child that's facing a challenge. So we went together with the doctor. Took off my heels. I was in a crown, a sash. Took off my heels.
Wait, why were you in a crown and a sash?
Because I was doing it as a visit of a beauty queen.
You're a beauty queen?
Yes.
Wait, hold on. So on top of the story of you being an incredible maternal health advocate, you're a beauty queen.
Yes, that was back then when I was working with my title.
That's amazing.
So usually when you walk in with your crown, you get all the attention. The doctor, the nurses are like, oh, how are you? So because they're like, oh, celebrities in here. So I walked in with my crown and sash, but then I had to take them off when I go to the premature unit because everything for me was a stress. So I told the doctor, what are you doing? So the baby needs an oxygen machine. So he was trying to put the oxygen machine on, but then it worked for so many hours. So it was giving a challenge to switch on. So he said such a thing, you see, the baby was almost turning green. So I was a bit frustrated again. But of course, later on it worked. The machine walked up. And I told him, why is the machine sleeping? He's like, no, because Doris, these machines are overworking. And we have there was only 2 oxygen machines. So from there onwards, I said, I'm going to do this. It's a noble cause. And there is a connection to disability. To some extent, premature babies do have a contribution of babies who are facing challenges of disabled. So he told me, Doris, the more the babies are being referred, they double the chance of not being survived, so of not being alive. So the chances of death. So from there onwards, that's where my story started. And it's 2015 that we launched the Doris Mollel Foundation to ensure that we look into the lives of the babies who are born too soon.
I love this story. I think it's so inspiring. And even hearing about your own journey and how you obviously have become such a champion for maternal health. What were some of the experiences you've had with moms and babies that you've witnessed outside of the story you just shared with us that have really shaped your commitment and passion and conviction around this issue, specifically in Tanzania?
Well, it's mainly 2 things actually that really, really hit me. Number one was, I remember in 2017, I walked into a hospital and I found 50% of mothers in that unit. There were 25 mothers. 50% of the mothers that I found in that unit were workers, and I started talking to them. So how do you feel? Is your employee understanding you? Is your family understanding your situation? Most of them told me they've been fired.
Wow.
They stayed there for 3 months. Some of them told me they decided to take leave without pay. And that frustrated me. So I asked them, what if it is that one thing that you want the government to do, what will it be? The first thing they say, we want the leave extended. We want insurance.
The parental leave.
Yes, we want insurance for these babies because we're paying from our pockets. And it's getting really bad. Some of us are selling our houses.
Wow.
So like one of the one of the mother was trying to sell me her phone so that she can pay the medical bill.
Oh my gosh. For her delivery?
Yeah, for her baby. Because she did deliver, but the baby was born too soon. And she has been there for 2 months.
Preterm.
And for every day, there's some charges that she needs to pay. So all that frustrated me. And I started getting myself involved in policy change and advocacy. So it's from then that we started to task the government to change laws and policies. So we first wanted to work on amendment of paid parental leave law to favor parents with premature babies, get the insurances, pay for the cost, because I cannot have an insurance and then I'm not covered. If I have a baby too soon, I have to pay on pockets. And then also trying to work with the government to, see how best we can incorporate the knowledge into science and biology subjects. So those are 3 main things that we started to work very fast as a foundation. It was a tough journey, But we're glad this year, in 2025, the government announced the extension of paid parental leave, and mothers will get 6 months, fathers will get 1 week. Of course, it was very tough. So currently, our country, fathers are getting 3 days.
Wow.
So whether you have
3
a preemie
days of
or
parental
not,
leave.
yes, for a father.
That's so hard to fathom. And I know that obviously parental leave for fathers is typically globally much less than moms. But even that just feels like such a disconnect, because how is one supposed to support the mother and her after-birth care and recovery?
So it's really tough, to be honest. Working dads wants to see their kids, but they're like the first day they first go, they get frustrated. The second day, the third day, they have to go back to work. So the week is not okay, but at least we appreciate the extension. That means the government has listened, has taken action to that. Most challenging is that also fathers do think that for them, they need to look for money and bring money back home. You know, the African culture. But we are proud of whatever achievement we got, especially for the mothers, because mothers are the ones who are really facing mental stress, especially when it comes to their babies and securing the jobs. So we are proud of that. It was a tough work, working with 7 ministries, members of parliament.
Amazing.
A push. You know what it means to be actively involved in pushing agendas.
That's amazing. You know, Doris, I think in the world that we're living in right now, it seems almost impossible to change and advocate for policy change that actually happens, right? And especially we're talking about countries like the United States, the United Kingdom, and how challenging it is to be able to change policy in these places. And a lot of times it feels impossible. So the fact that you were able to do that in Tanzania and create an unprecedented path of disruption to the status quo is absolutely astounding. And that's something at Every Pregnancy we talk a lot about, is about we are here to disrupt the way that maternal health is approached, is funded, is even perceived in the salience around it. Let's not keep that as a silo. It should be a conversation into every conversation. If you're not talking about a mom's health and not just her survival, but even her thriving ability to continue to be the backbone of our families, of our communities, of our society at large, then we are creating a pattern of just continued injustice. And we talk about this a lot on this podcast, about the injustice, that if we do not change the systems in order to support moms in their pregnancy journey, pre-pregnancy even, but pregnancy, delivery, and after birth care, including caring for preterm children and babies, then we are just continuously believing and embedding a system of injustice, truly. And so what are some of your reflections on the fact that you have said something so unprecedented and disrupting the way this work is done? I hope you feel really proud of that, because it's incredible to see. And I remember when I met you in Geneva earlier this year at the World Health Assembly, we were talking about just the work that you've done on the advocacy front and how all the ministers know you by name. You can reach anybody in the government. Just one phone call, one WhatsApp message, they'll take it from Doris. That is something that's a really beautiful skill, but it is so unique to be able to be not just a champion for maternal health, but you are part of the apparatus on the ground of how they're building the landscape in Tanzania to support moms and babies further.
Yeah, I'm truly proud. I am truly proud, because I felt the gap, and working for the gap and making sure that really you're creating a solution. It's really a proud moment, because there are sleepless nights. There are times you get frustrated. There are times you want to stay off everything. But when you see the work that you've done has truly become a success and mothers are feeling it, that's where you feel like I've done something which is very significant. So now parents are getting rights, insurance are covering them, government has budgeted to cover for premature babies. Now the whole country is busy on investment of small and sick newborn babies, which that. Premature babies are taken up front.
I see what you're saying.
So I feel that that really means every pregnancy is taken care of. They consider each pregnancy as an important pregnancy, because this is human capital that we're creating.
Absolutely.
This is human capital that will create a GDP of the country. So taking care of mothers, especially pregnant mothers, is like you're taking care of a future human capital. So every leader, if you get to their level and make them see that this pregnancy is a future human capital, we've got to take care of it so well from pregnancy to delivery, then that means we're saving so many lives And we're taking care of so many stories that are future of our globe, that our presidents, our leaders, are, you name it. So I feel like everything that we need to do in our activities, our work, we need a political will. And the only way you can get political leaders to understand what you're doing is getting them typically involved, get them at the front line, get them informed. So when you get them informed, get them in the line, it's a slow thing. Sometimes they tend to be very hesitative, but when they get to see the results and what that will mean for their votes, definitely you're changing lives. So for me, I believe that in everything we want to do, if we want to make change, we need to get a political will. As soon as the leaders understand, even if they're not coming from a medical background, it's easy for them to act on. They'll put money on it. They'll invest. They'll change policies. They'll change their narratives. But it really needs skills to navigate their path.
Absolutely. And I think that you even laid out a roadmap for people who are listening. One is that you brought them in as stakeholders from the beginning of your work, that this was not something as we've designed this strategy and this approach and we just want you to implement. No, we want you to co-architect and co-design this approach with us on how to support moms and babies via the policies that we set forth in Tanzania, but then from the policies, right, investing and following that with funding. And so I think that you have raised a really important point that is one of our primary objectives as Every Pregnancy as a coalition, which, you know, your incredible organization is part of and you are part of, is understanding that the way to change the root causes of why moms and babies are dying, whatever context we're operating in, whatever country we're talking about, is by truly addressing who are the key stakeholders on the ground, who are leading this effort, who is speaking, the champion, the voice, all of that is critical. And you have to uplift those local partners, the local people who understand the moms and babies, then the people who caretake for the moms and babies, the doctors, the midwives, the birthing assistants, then the government who is there, who's responsible to deliver the best services and care for their people. So you have really built that network where you realize that the best change and the only way change is going to be sustainable is going to be if you follow that system and you develop it from the ground and root cause. And I think that you are such an incredible champion. But I have a question for you on this. What do better outcomes look like for premature babies, in your opinion?
Well, for me, better outcomes is their survival, despite of their weight. Because for us as a country, we're that country where when you have a baby less than 1 kilogram.
Oh my gosh.
So
1 kilo.
1 kilo. If you have a baby born less than a kilo and you're in a district, you simply get frustrated and out of control.
Wow.
So for me, I feel that if a country is able to take care of babies below that weight, that means we're getting somewhere we're supposed to get. Because most parents believe, oh, if my baby was born outside the country, or my baby was born in Europe, they would connect that to our African context. But me, I believe where we're going as a country in Tanzania, we are now getting to where we save lives of 800, 600. I know a baby who was born 450 kilograms and he's still alive. He's in grade 4 right now.
Wow.
But this is half a kilo. I know such a baby. So this means with the right technology, with the right human capital, even if it's one human capital, but you're empowering the moms to take care of their very own babies while they're still in hospital. We're talking about zero separation. We're talking about that immediate kangaroo mother care.
Absolutely.
That's where we get the babies and mothers to have that sanity and the way of raising their child while still in hospital. Because at the end of the day, usually I see, no matter how many funds we inject, and the health system will not be able to have enough nurses to take care of these babies. That's very hard. But the less nurses we have, but if we equip our mothers with enough knowledge on how to take care of them, but of course having enough space for the mothers to take care of their own babies through immediate kangaroo mother care, then naturally we do save many more lives. So for me, I feel like as a country where we're heading is very nice because now government has budgeted to cover for premature babies. So I see so many scholarship of nurses going for neonatology, doctors going for that. So we are really running so fast. And the country has really seen that when the moment we take care of the babies who are born too soon, we automatically save lives of babies who are dying, because prematurity contributes up to 48% of death. So when we take care of that part, we save more than 50% of babies who would be dying every year. So I see how everyone is really looking to how to support in investment of care, whether it's training, whether it's building neonatal care units, whether it's equipping. So there's so much of that. And we as an organization, we are really proud that now we're building the first standard neonatal care unit in Tanzania. It's an MNCU.
I love that.
And
congratulations. That's huge.
Thank you.
The first one?
The first standard in Tanzania.
That's amazing.
Because what we have now is called improvised rooms. We have a room let's improvise and keep babies and mothers. And most of them, not all times that mothers will steal their babies. So we feel like this standard neonatal care units will really make a change in the history of policy and advocacy. So for us, that's an advocacy tool. We want to see every mother who's pregnant to feel safety of their baby, disregard of the circumstances that she's coming from. And I see and feel how the government is supporting me in building and equipping that facility. So our work is to build and equip, but again, the government is putting staffing on it. And so we're really proud of our partners who have understood the assignment. We call it understood the assignment. They have understood what we need to do, and then there to shape up the narrative and set up standards of how and why we want mothers to be treated with dignity as far as them giving birth and taking care of their babies.
And we love when people understand the assignment, because we say that culturally here in the U.S., like a slang is like, you understood the assignment and you showed up the way you needed to, the way you were expected to.
Yeah.
So I love that you're delivering that on the ground in Tanzania, and congratulations on that new facility. That is absolutely incredible.
Thank you.
Doris, there have been reports that show that only 0.6% of major donors fund local organizations like yours. What systemic changes are needed to create the kind of future you'd like to see in neonatal maternal care, whether that be in Tanzania or more abroad?
First of all, for donors to put their funds where they say they're putting. So not to be offended by the big organization, but I'm straightly saying donors need to put their words where they really are meant to be.
Yeah.
Because I feel like for the longest time, donors have been putting funds to admin cost, to big organizations that cut a lot of admin cost, of which you could have given funds to local organizations who are really busy on ground, changing narratives, supporting the community on hand. And instead, they fund the big organizations, which by then, the smallest organization are subcontracted to do the same activities. So I feel like donors have not, for the longest time, donors have not given the trust to the local actors. And I think now with the funding challenges, aid cuts, donors need to shift their narratives and the way they work. They need to work with the local actors.
Absolutely.
Because the local actors, they know the problem. They know how to do it. They know what time to do it, at what position will really make an impact. Big organizations, they know how to do the best report. They know how to, they sit on the same tables with these big donors, so it's easy for them to lobby to get the funds. But again, as they get the funds, they do a lot of admin costs, of which you could have taken the same funds to do and implement the tasks. So I'm calling out to all donors. I want to see them putting the funds in the right place, put the funds to the ground actors, where impact is seen in immediately.
Yep, and that's exactly what we believe in as every pregnancy as well. It's how are you funneling the funds to the people that know how to reach the hardest to reach areas and the hardest to reach moms, where the need is tremendous. And also, which is an important point that I'd love to get your thoughts on, Doris, the culturally tailored, the sensitivity, the understanding of the community at that granular level, because the people that are those local drivers, those local implementers, are indigenous to these communities often that they're in.
Yeah.
And so we need to be investing in them, because there's no one better to actually know what the community needs, what moms and babies need, more than these people. And there's no one more suited to lead this effort that is, and the solutions that we need to see more than these people. So we truly believe that, and we actually use that and talk about that as every pregnancy, that's one of our big value adds, is that we're not a traditional NGO, we're not an aid actor, we're not an implementing partner ourselves. We're this incubator, this aggregator of this incredible partnership coalition of organizations that are on the front lines, that are indigenous to these communities, that can deliver, and that really where funding should go, but also from a financial perspective, that have very lean, agile models where the overhead is so low that you are expanding that dollar, that you're making it go 10 times farther, depending on who you invested in. So, this is not about offending any NGOs or any of the ways that the aid system works, but we know that model doesn't work most effectively. We know it's not what's causing the most impact. And we know, and the data shows, that the most impact comes when local leaders are implementing local solutions in the communities in which they belong to. And so I really love that that's a model that you're even calling for and say, invest in us. We know what to do. We can take that dollar so much further than a big traditional aid actor or multilateral actor would do. So what are your thoughts on something else that I'm giving the reaction to you on?
Well, for some people, when they hear I say that, they're like, you're pushing away the international organization. And I'm like, no, we do work with international organizations. For example, Keep a Child Alive.
I love that.
The Alicia Keys organization. They're funding us to build the neonatal care unit. But hey, they could have gone through somewhere, an INGO that is in the country, and then find Doris Mollel Foundation, and then get Doris Mollel Foundation on the ground. The admin cost that is catered for that is the money that you use to buy equipment.
Absolutely. And medicine.
And medicine. And just ensuring that nurses are well taken care of. So for just a little example, we're building a nursing home for 85,000 USD. But that could have been an admin cost of a certain organization.
Yes.
So like for us, every dollar counts. Every money counts. And that's what even they came to see it. They said, oh my God, every dollar counts. Like we're really taking every money on the ground to make sure we build a proper infrastructure, but we equip it, and then we have a good staffing on it. So for me, I feel like we need such funders who understand what it means to work with local actors and not being an intermediary of, slowing the funds. So there's a funny cartoon in Tanzania.
What is it called?
So that funny cartoon has no name, but this is how they do it. So they have a very big elephant, which is the aid fund or donor philanthropic funds.
Okay.
And then the way they come and channel to the act on ground, it's like you have a big elephant, and then you have the smallest one. So they say, so this is an INGO. Then they come to a smallest NGO, and then they come. So by the time it reaches to that person who needs to receive it, it's a drop.
Peanuts.
While they could have just taken a shortcut. Hey, why don't you give directly to that person who's on ground is doing this activity? So most of them will say, this small organization have no capacity. That's the thing that normally most funders would say, but this is my take. I don't agree to no capacity. I believe in, if you know that I'm passionate about this work, you have to believe in me and invest in me.
Absolutely.
Invest in me so I can do it better. Invest in me so I can do much better. Because again, as much as you want that type of capacity, why don't you bring that person, stay with me on ground and work with me and see how I do it. So such a way in 1 or 2 years, I've already accommodated the way you wish for me to work. But don't take all the funding to a big organization that will start to micromanage. Take a very big fund. But again, even the way people are supposed to receive that support, they get a very penny out of it. I'm not sure if that's what the funder would want, like the person who really is giving out the money. They want to see the money on ground and doing what is meant to be.
100%. First of all, Doris out here speaking truth to power, dropping mics everywhere she goes with those lines. If you believe in my mission, invest in me.
Yeah.
That's what it actually takes. A lot of times people think empowering communities is about finding ways to support them with a lot of bureaucracy and through a lot of channels and struggle. Like you said, how the funnel of when the funding actually ends up there, it's the smallest fraction of what it could be. But whereas if you invest in the proper actors and you give them the big chunk of resources and in empowerment, really, you then will see that take off. and you'll see that they'll only accelerate. I truly believe in that. And they'll use that funding as catalytic investment. And everyone loves to talk about catalytic financing, catalytic investments, especially here we're in the streets of Unga about to kick off this year. And I'm sure we're going to hear this term a lot, talking about catalytic investments and what does that really mean. To me, catalytic investment is investing in the community, lead the work, and watching it take off. And we saw that model in action with every pregnancy for our Ramadan campaigns, the For Mama campaign. And the For Mama campaign is our Ramadan, which is the annual the month of the year where everyone is fasting in the Muslim community. And it's the month of giving, truly. And as I'm sure you're familiar with this, people love to give their zakat, their sadaqah, jariyah, everything that really happens in Ramadan, it's all elevated because that is the month of truly charitable giving. And so we decided that we wanted to mobilize the grassroots community as the Muslim community to care about maternal newborn health in a way that they care about food and water and orphan support in this month of Ramadan. And that was part of the origin story, but also one of the core mandates of every pregnancy is to build that community salience, the community ownership for this issue. And we got a $3 million catalytic investment into a match fund from our incredible foundation supporters. And it took off in the community. Wow. With that investment, we were able to raise $21 million in the month of Ramadan via our partners, of course, the implementing frontline partners like yourselves who are out there talking to their donors. We have this opportunity for match funding to boost our donations that we're raising for these critical programs. Give to us. And we saw over 37,000 donors give to the Ramadan campaign this year for Mama. And it just proved to me that this model works, that the community will respond when there's investment into them and what they're doing on the ground. And that partner organizations, the implementing partner organizations, feel more empowered when they know that this funding is coming directly to them. So what are your thoughts on a little bit of that? And then I really do want to talk about a little bit of the challenges that you're facing even in the community on the ground in Tanzania with moms and babies. But anything else you would talk about on the catalytic investment and further investing in you, Doris Mollel?
Well, just bolding my thoughts on investing on that visionary leader. It's truly impactful and meaningful because the visionary leader is that person who doesn't sleep until they see this work is done properly and it's the way that it's meant. Just like the way you're leading every pregnancy, you want to see every mom, every baby surviving and in a better care.
Absolutely.
Better conducive environment. So it's the same way. The visionary leaders in Africa, they need to be well supported so that they can do this work better. And the support comes into that person and the team that is tagging along with that visionary leader to ensure sustainability. What I feel like when we don't invest in such kind of visionary leader, what is really happening for so long is that the big organizations or traditional funders that will come in country, they will do what local actors are doing. They will try to do what local actors are doing. And when the funding has ended, the project or program has ended, they leave the local actors uncertainty. Then we don't have sustainability. While if you invest on that local actor, you are ensure the work will continue.
Absolutely.
And will continue in a better environment because you've already added an empowerment capacity with or her team, but of course you've made them realize and understand what it means to do work in a better way. Sometimes not just in a better way, sometimes you will learn from them. You come with an idea that, I'm going to better up their work, but actually they're bettering you up in the way you need to understand the context. Because when you're sitting, let's say in New York, and you're designing programs on ideas of funding, you need to design funding with the ones who have a challenge there on ground.
Absolutely.
So I'm really looking at a change in the way funders create their funding. I would wish they sit down with local actors and create the funding with them. So before they bring a call for proposal, they already know what are we cooking? What should we do to really bridge in the gap that exists in the community? So I really don't like it when they say, it's a call for proposal, maternal and child health. You're doing small and sick babies, you're doing ABCD, so they put that there. But they don't go to specifics. They just they want to read a proposal and then that's it. But what if you create a call out of the community's actors that you've sat down with them, you've traveled there to see, these are the challenges. When you bring a call for proposal, you really know what you need to expect in the proposals or the request that's coming for funding, because such a fund will really be an impactful.
Absolutely.
Yeah, there are call for proposals that have been really of impact, and you see how things are there, because you'd feel that this person has really been on field, whether it's her or his team has been on field, to really see the differences. So that actually will reduce the number of corrupt ideas that are coming through, because sometimes now people would need to, do you know somebody somewhere to help you? You don't need that. You only need a real good, genuine, good solution to help the community. So funders should find their best way in creating the funding for proposal with the actors. Like, sit down before you bring the call for proposals.
I love that idea. And honestly, I have so many thoughts to respond to on that. But the co-architecting, co-designing a response together, a solution together, really should be the way forward. And it's sometimes crazy to me to think about how it hasn't been the way that it's done, because it really does still feel very top down, very much where Western ideals and Western principles on how these issues should be managed and solutions for these should be managed on the ground in countries that they have no idea anything about, right? The cultural context on the ground. So when are you bringing in, as you were saying, the stakeholders? It's almost like you reverse that model and you think about, as a funder, you should be really bringing in stakeholders, including local partners, to help you co-design and co-build something, versus coming at them with a design and a vision that you have for them to implement. Because they're not just implementers. They are the people that know the solutions the best. And when invested in, can drive change, I think, so much faster, so much more efficient, and greater impact than anyone else can.
Sure.
And one thing that I was thinking about around capacity building, because I think it's such an important point to say. Oftentimes, you're right, I've heard funders numerous times say, well, you don't have the capacity to handle this grant. You don't have the capacity to handle this type of money. But for me, my answer now is, how do you build capacity without investment? How? Just answer it. Like, if you want for me to build capacity, or if I don't have the capacity, that's what I will build with the investment. Invest in the vision, and the capacity will come. But the capacity can't supersede the investment.
Yeah.
Because what are we working off of, right? Like, we want to be able to build something that we know there's a guarantee, there's security financially for communities and folks. So I really do believe that the model, even for that, the protocol, quote unquote, really should change and shift to where the investment should lead to development of capacity, to strengthening, co-designing the best solutions, and then to co-implement them together, and reporting in a way that really does even change the way that we're looking at it. Enough with statistics and just numbers.
Yes.
Pretending that this actually means anything half the time.
Sure.
Yes, of course, we love to see reduction in maternal health numbers. We love to see that, oh my gosh, we reduced it by X%. But what does that really mean? I want to see evidence of the anecdotal evidence. I want to hear stories of moms and babies. I want to see the connections that were made because of this funding. And that is so not part of the traditional reporting systems. So I think that there needs to be a disruption, back to our point of who we are ethos, to all of this. And you're really calling on the disruption as well. And that you see and because you work with funders and you are talking to people left and right, especially as we come up to this week, let's change how we approach this. We can see that the traditional aid funding models don't work. That's why we see USAID being shut down. Like, they don't work. And when they do shut down and you have these big funnels of investment just cut off in one go, it impacts the people who need it the most because it trickles down.
Sure.
And then you said so many organizations don't have sustainability because they don't have the reserves, because they didn't have the investment.
They were not invested. Yeah,
exactly.
Nobody was investing on them. Yes.
Who hurts the most in these situations? The people that need it the most, the local implementers. But what's the change is if the funding model shifts and changes, you actually empower them to be able to be sustainable, to have that security, to where their work is protected, because they're the ones who should be protected the most, being on the ground, serving moms and babies in other communities.
Very right. I mean, I totally agree with that, because we feel that in the country right now. And everybody was like, I think that the funding was supposed to start with the local actors.
Exactly.
Not foreigners coming in country to just work for that aid.
Yeah, parachute in.
Yeah.
Drop them aid in there and then parachute right back out, because they don't actually care. They care for that project delivery.
Yes.
But do they care about the community that's going to have to continue to live there day in and day out after they leave? What happens to them? I always wonder that. I've read so many stories of corruption, honestly. And I myself have been in the NGO space my entire career. I've worked at some of the biggest NGOs, biggest ones from Oxfam, Amnesty International. And I've also worked at small local organizations like Syria Relief and Development, a Syrian NGO that was born out of the Syrian Revolution back in 2011. And I've seen firsthand the difference in approach, difference in investment, and even to your point of how much resources a lot of times are wasted in the administrative bureaucracy. And it's not a fault to the big NGO. They have operations in place.
Yes.
But I can tell you, when I was at SRD, Syria Relief and Development, which is an incredible full circle moment, they're part of the Every Pregnancy Coalition, I saw how that $1, that $50 donation, how much of it went directly on the ground. The overwhelming majority of it went directly to that portion, to the people on the ground, to be able to serve and support them. So truly, this is just undeniable facts. And the more we actually socialize it and talk about it, the more we can get to the solutions that will build that sustainable long-term vision that we want to see. But let's stop avoiding talking about it. And let's stop avoiding saying, okay, well, one day we'll see that happen. Why can't we actualize this now? Right? Like, why can't we work towards this together now?
We have to. I feel like this is the right time where we need to continue pushing, especially on meetings like this, where all the funders are here, all the majority actors are here, the global actors are here. They need to hear these voices. They need to see now the community actors are demanding a shift of funding and the modality of how they fund the community activities on ground for sustainability. If we want the communities to continue doing community activities, we need to make sure they're sustainable, and the best way is to change the way they fund.
Absolutely.
Yes.
I'd love to hear that. So obviously, a beautiful continuation of this conversation. I want to take us back into the context of Tanzania on the ground, because I think something that our listeners really value in this podcast is the fact that the guests that we talk to are champions, local champions. And oftentimes, again, we get caught up in what the reports are saying around maternal health, the statistics, the numbers, and we forget about what are the true challenges on the ground. And also that maternal health is not even monolith in itself. It's not a blanket. It doesn't look the same from country to country, from city to city, from village to village. And so we really want to always bring that up to the forefront at Every Pregnancy and on this podcast, Born Into, that changes. And so understanding the cultural context of the ground, of the community you're operating in is so critical. So what are some of the challenges and the barriers of moms and families and husbands and partners and mothers-in-law even, to being able to change the system on the ground to support moms and babies? And I'll just give you a little bit of more context here. In Pakistan, when I was there firsthand, I saw some of the challenges, and I didn't even think about it going in. And the challenge that I saw is that, for example, even with birth spacing, family planning, right? But you can't call it family planning in some contexts. You have to call it birth spacing. And the delicacy and the sensitivity around how you have to handle this issue and how you have to counsel moms to recognize that the more time they have in between their pregnancies, the healthier it is for them to have better outcomes for mom and baby. And I didn't realize what a issue and a challenge birth spacing was on the ground in Pakistan, as I'm sure it is in many countries. A mom oftentimes feels pressure that she has to keep getting pregnant to keep her family happy, her partner happy, but also, depending on what her faith is, this is part of her mandate, right, in her faith. Culturally, same thing. It's an expectation.
Sure.
And so moms can't push up against that expectation without feeling like, are they doing something wrong? Do they feel guilty? Is it worth the risk even? And then you have fathers who are kind of removed a lot of times from this whole conversation because they can't be in these appointments, they can't be in the delivery room with the wife, and in Pakistan specifically. And so how are they understanding and seeing the outcomes for mom and baby, for where if they continue to grow their families and not have birth spacing adequately, that it's going to harm negatively their family unit that they're working so hard to build. And then you have the socioeconomic status around that too, all the challenges. So there were so many challenges that we were like peeling back. I felt like an onion, and each challenge had another challenge associated with it. And it kept just driving back to, where's mom's agency in all of this? Where are women's agencies? To be pregnant, to have pregnancy, to want to continue with a pregnancy, to want to have a safe pregnancy, to want to have a safe delivery. And there's so many different markers in that. But I would love to hear a bit more about what is happening in this context on the ground in Tanzania.
Well, that's a very good question. It takes me back in days where the African traditional way of life is we had something called the traditional birth attendants.
I met and learned a lot about them in Pakistan, TBAs.
Yes.
But they're not formally trained, at least in Pakistan, they're not formally trained, which causes a lot of risk and liability as well.
Very true. But if I take back the life with the how challenges, with so many challenges that encountered, but I felt like the modality of what our past parents had set up, I feel like they set up a very good way of following up a pregnant of a mother. Following up the pregnancy. The traditional birth attendants, even the community themselves, they knew house number X has a pregnant woman, and with the way she looks like, she is expected to deliver at a certain time. So even the community themselves, they would be very much keen to know how is the pregnancy doing. For some reason, away from the traditional birth attendant, but the community itself will be like, how are you doing? How's your pregnancy doing? And I remember my mom used to tell me, when they come knock at home, like if visitors come knock at home, and when the mother has really been late to come back home from fetching water, they know she went to the ocean for delivery, because they know they usually go for birth water. They give birth on water.
In the ocean?
Yes, that's way back.
Way back one.
Yes, especially on areas where it's a lake zone. So a traditional birth attendant and the friends would go quickly to go help her deliver. And normally even herself should be entitled to say, I'm going somewhere, I'm going to fetch water, I'm going to fetch some few sticks for cooking. So like there were so many, my mother felt like she's obedient. She needs to tell the right information to the closest people. But right now, our lifestyle has changed. And so the context of Tanzania really is heated by the culture. So, and culture has different dynamics depending on where you are, which region, and how do they perceive women. So as much as the government has really done a good work to make sure that traditional birth attendants are given their line, of course they're equipped with enough information, but now there's a very big tendency of investing knowledge on healthcare workers. So the community healthcare workers now have really been equipped with knowledge to make sure every pregnancy is safe.
I love that.
It's an ongoing marathon. That's what is going on right now. And these community healthcare workers are now in the government payment. So a community healthcare worker is not just a community healthcare workers for free, but they're given some little token allowance for them to be capacitated and motivated to work. So now the traditional birth attendants, most of them have upgraded their life to being community healthcare workers. And the good thing is the community healthcare workers are picked by the community themselves. So in our context, we feel proud because now CHWs are given a special eye of attention, and I believe in the coming years they will be given even more of that, especially in terms of the allowances they get, to be formally recognized in the community, because they do a lot of work compared to even the nurses or doctors. Why am I saying they're doing a lot of work? Because they're on ground. They know what's happening in terms of health, and they take it to the nurses, and then of course the doctor come in. But they are the ground actors. So I feel good that now our country is investing in those community healthcare workers, because they're the ones who are changing the narrative in the primary healthcare. So that's where we are at a context level, especially in our country. So we feel proud that if mothers are giving birth in the village areas, we know there's a community healthcare worker in charge, whether it to be to transport her, whether it to be to give the right information about a certain mom somewhere who's facing a challenge. So I feel like if any other country has not done that, they should see the role of community healthcare workers in shaping narratives, in changing the way we want to take care of these mothers and ensure safe delivery. So community healthcare workers play a very big role in making sure that we have a safe delivery. Now countries away from that now is investing on the infrastructure of making sure the work. Now we complement the work of CHWs. As much as they are equipped with knowledge, but we need to see the right infrastructure for these mothers to deliver safely, and of course taking care of these babies who are born with challenges and different malformations. So with me, I feel like I'm a proud Tanzanian. As far as health is concerned, I'm very proud. There's so many change. There's so many shifts, and I feel like it comes with the political will. Again, we have a female president, so she's a mother.
Yeah,
and being a mother itself makes you grounded to understand what are others going through. So we feel like in the next coming years on maternal and child health, I feel like Tanzania will be one of the leading examples to the African continent.
I love that.
That's what I feel.
And I see that. I see that vision. I see a lot of even just the work that it's being done on the ground. Obviously, you championing so much of it. I love that vision. And one of my questions for you, which is perfect if you wanted to add anything to it, is what does the future look like for Tanzania's moms and babies?
The first thing I will tell you, which I'm totally confident about, the next 5-10 years, the reduction of neonatal death will really get down significantly. That's what I see, because I see a typically huge investment of small and sick newborn babies, the investment of care. I see so much shift in policy change and law change. I see that. It's a drastic move. It's like president is telling everybody we need to run and make sure we take care of this part. So I've done so well in reducing maternal mortality, but we have not done well completely on reduced neonatal mortality rate. So I feel, and I see all actors, even funders, when they come into country, they are told the priority now is small and sick newborn babies. The priority now is neonatal care units. We want to build more, we want to equip, we want to train healthcare workers, we want to have more pediatricians, we want to have neonatologists. So I see that it's ringing on my bell. Whoever is a funder, corporate, local, in health, that's the shift. So even local organizations themselves who are doing something else away from maternal and child health, they want to come and do maternal and child health because they know there's a funding for it and there's a political in it. So for me, I feel like in the next 5-10 years, we'll be talking something else about saving lives of small and sick newborn babies in general, because I see that's where the government has put its feet so well.
I love that.
Yes.
I love that. What a beautiful message to share. Doris, I could talk to you all day. And unfortunately, we've been recording this podcast for a while, and just listening to all your beautiful vision, you can tell that you were so proud to be a mom, to be an advocate, to be a champion, to be a Tanzanian. I think that's so special. What would you want our listeners to listen to this, to take away from this conversation today? What are some key messages really for them to listen and say, here's what I can do to support, or here's what you want them to think about?
Well, great. For me, the only thing that I want them to take away with is every pregnancy matters. Every mom, every baby deserves a chance to live and to give birth in a safety manner. Dignity of a mother is important. And to all the funders listening, we would love for you to change your narrative. We would love for you to invest in local actors, invest in people who you think they will do the better job. Like, put your money where you say you will put, where money matters, where every dollar will count. And whether it's being in Malawi, being in Tanzania, being in Kenya, being in Sudan, Congo, just put your money where it will matter. And where it will matter is invest to the local actors. That's all I can say.
That's beautifully said. And I mean, mic drop again. Honestly, Doris, thank you so much for sharing your story and the incredible work that you're doing.
Thank you,
at Doris Mollel Foundation. How can people support your work? You personally, what can they do?
Well, we need all types of support. Being a volunteer your time, volunteer your knowledge, skills to support us grow more. Support us by donating. We have go to our website, dorismollelfoundation.org. All the information is there on how you can contact us, and make every dollar count.
Absolutely. And invest in local actors.
Yes.
And then a champion like Doris Mollel, everybody, I think it goes without saying that you know what to do,
Yes.
You know where to subscribe, and you know where to follow. Doris, thank you again so much. It's an incredible journey of even how we connected when we were in Geneva, and how you know members of our team here at Every Pregnancy, and now you're part of the coalition, and now we're co-building and co-designing what maternal and newborn health should really look like and should be responded to, because ultimately we shouldn't even be having these conversations where moms and babies are dying from completely preventable reasons and complications. And so for us, this is the world that we're working towards together. And to be able to co-build it with you and with people of Tanzania is such an honor. And I'm so privileged to be able to even have this conversation with you, but also to help think through and support you in this mission. So I hope that anyone who's listening today continues to support the Doris Mollel Foundation. And to learn more about them and how you can support or get involved, please look at the links in the episode notes. We are so honored to be able to host guests like this on To Born Into. Continue to support our podcast. Follow at Every Pregnancy on social media and go to our website, everypregnancy.org, for ways to stay involved, to support our partners. Well, you'll see Doris Mollel Foundation also on our site, and to always make and join us in making every pregnancy safe. Thank you, Doris. I'm excited for this week in New York. What's the one word you're feeling today about New York?
I'm excited. I just want to see how we can make the best of everything to make mothers safe.
Let's do it together. We're in this together.
Yep.
Woo-hoo! Thank you so much.
Thank you,
everybody. And that's it.